everybody for being here today. My name is Dirk Dykstel. I'm from the State Department of Health, and this is our kickoff meeting for these listening sessions on the from the Department of Health as well. Lindsay is our operations manager. We also have Lisa Wardman from Public Health, and then Dr. Haas, who is our medical director, all here to hear from you. If we're doing this right, you're not going to hear a lot from me. We really are here to hear from you and hear what your priorities are. So we're going to start off just with a quick overview of some of the opportunities that are coming to Wyoming, or at least here are opportunities for Wyoming, and talk about the Rural Health Transformation Program, where that comes from and what the planning process is unfolding right now at the state level. We'll also talk about that application process. So when does that need to be submitted? What is it? What are the opportunities there? And then we'll also, and the vast majority of the time we really want to spend is hearing from you of what are the priorities, what are things that are going well, what are things that are challenges, and also things that you see as the highest priorities here in Wyoming. So we'll start off quickly with just what is the Rural Health Transformation Program. So this comes from the One Big Beautiful Bill that was passed back in July. In this, there was also a fairly large sum of money that was set aside for states to apply for really anything that is related to rural healthcare, innovation, a transformational investment into rural healthcare across the nation. And it's really a one-time investment. It will come in the form of a 5-year opportunity, meaning that funds will come year over year for about 5 years. But it is a one-time investment. This is not an ongoing program. It is federal funding, so it is something that needs to be applied to by the state, and that is part of the process that we'll be talking about today. So what does that application timeline look like? Right now, we're in the phase where we want to hear from our stakeholders. We want to hear from Wyoming residents. We want to hear from everybody in Wyoming, specifically in the rural areas. The application timeline, it has still not come out from the federal government. The notice of funding opportunity will come out sometime in, well, it should be any day now. They said mid-September. Then from there, in early November, the applications will be due. So we're taking the time right now to understand what are community priorities, what is going well, and again, what are some challenges so that we can align any application that the state submits to be in with those priorities. We likely will not hear if there's a submission, whether those are awarded from the federal government until the end of the year. So it's actually a pretty quick turnaround for the size of the funding opportunity that there is. So you've heard me talk that we're doing stakeholder meetings. So we're trying to go around the state, do in-person, and also trying to collect voices virtually. We're starting off here in Newcastle, and we'll do one here this afternoon. Thanks for taking your lunchtime with us. We'll then head down to Wheatland, and then we have a ton of other locations that we'll be going to as well. So if for some reason you know someone that maybe didn't have the opportunity to come in person today, there will also be virtual sessions. Those will be here on the 23rd and 25th. We do have printouts. Yes, I know there's a long URL right there. Please don't worry about that. If you want information on that, that will be posted to our website at health.wyo.gov. I believe it's right there. But also, if you want to take that as part of the PowerPoint slides that we printed out, that information is collected there as well. We will also be putting out an online survey that's very geared towards what we'll be talking about today. That will be released in later September. Again, we're trying to collect as much information from residents and stakeholders on what are the healthcare priorities, especially in the rural healthcare system. Okay, and then we've also are trying to send out letters to healthcare associations, healthcare stakeholders, to really hear what are some ideas, what are things that are going super well or just real, immediate needs in the rural healthcare space. All of this is just trying to inform you of the steps we're taking to hear from stakeholders, hear from residents on what the priorities are. So what we are going to do today, and what we would like to do, is go through some structured exercises first, and then have some open dialogue of what is priorities and what is going well and what are challenges. really what we're trying to address is what are your main concerns when it comes to healthcare in your community. We would love to have this specific to your community, especially in a rural setting. We also want to know what is most needed in your community, right? What are some investments or what are things that are, maybe not here that are needed? We also want to know, when it comes to healthcare, what is going well? What are things that you think are, vital, that are going very well in this community? Basically, what are wins that we can add to? Also, what is not going well, and what do you think your community needs? Those are really the focus of what we're trying to obtain. So, I just want to make sure, has everybody gotten a sheet? We have these printouts that we'd like to walk you through and collect some information before we get to some open dialogue and hearing from you all. So does everybody have a sheet and something to write with? Okay, fantastic. So at the top of this, you'll see right here we have just some optional information. This information is just collected. It helps us kind of talk, or when we look back at these later, know where the feedback or the responses have come from and what community. But the first exercise that we really would like to go through is talking about broad healthcare priorities. So you'll see a list of 3 columns. Come on in, sir. Let me.
Anyone else have a problem? Thank you very much.
We're going to have to hopefully fill that out. So again, starting with the first one, what we would like you to do is you'll see a column on the right-hand side of the first box at the top, and it's talking about the broad healthcare priorities here in Newcastle, in Weston County. And what we would like to know is, as a society, what do we need to prioritize? What are things that need to be prioritized in the healthcare space? Is it the lower cost of healthcare? Is it increased access in a reasonable distance, right? Is going to a healthcare provider. I have 2 young kids, and one is actually type 1 diabetic, and it's tough for us to have specialty care in our community. So things like that is a very high priority for me. So again, second one would be access to care, and then the third one is improved quality of care, right? And so here's 3 priorities. Rank that according to how much you believe these are a priority. So, the totals on the right-hand side should add up to 100, just so we get a good sense of, how you would be voting or prioritizing that. But just in a broad sense, what are those priorities? So, let's take a few minutes and make sure that we can fill that out. And please let me know if anybody has any questions on this first one, and we can go over this.
Thank you.
Okay, so I would like to talk over this before we move on. So would anybody like to start off and just say, here in Weston County and Newcastle, what do you see as a top priority out of those 3 categories?
A lot of representation from Weston County Health Services here.
Okay.
And stand. All of us. We have our board chair. We have everybody here today. Stand up, Keisha. Aaron. I'm not a spokesperson, but we had, I think our EMS is a really big area that we're struggling with right now just because of the bridge that we're a very large county. We have had a great install of our new CT machine at the hospital. But we'd like to see some additional programs. Diabetes care is one of our biggest things that our new medical director and Dr. Craig McCarty has just joined us at the clinics. Would like to see come into our area just because of the way that we have to send those patients out. They have to travel to Rapper, they have to travel to Gillette, and we're an aging community. So we want to see that happen. We also want to make sure that we get our cybersecurity beefed up because we would like to be able to see that we're not exposing our patients' information to risk or to be able to have that be extorted for money. Our CEO is not able to be here today due to a death in the family. But our biggest thing is just to make sure that we can train our people that are here and make sure that we can keep that retention at the same time.
Thank you very much.
Who are you looking to train and retain?
What are we looking to do? We have a very large high school here, and we like to make sure that we offer those internships or making sure that we're showing those children that there are great opportunities for healthcare. And by doing that and making sure that they're getting certifications, making sure that our doctors are up to date on continuing education, sending our nurses off, especially with our new diabetes clinics that we're gonna be doing, chronic care, making sure that we're up to date. We're rural, but we have a lot of great staff that can provide that information for us.
Thank you.
Yeah, thank you very much. Awesome. So thanks for getting into that. We would love to continue to hear. It sounds like access is a big priority. Does everybody agree with that? Do we feel like access is the top priority here, or is it cost of care, quality of care? Love to hear more on that.
So for me, as a healthcare worker, as well as a board member at the hospital, it's access first and quality second, speaking to the training and all that we'd like to provide to our staff to make sure that the care that we're delivering is of the highest quality and meets our needs, meets the community's needs. And we can't do that if we are not able to fully train our staff.
Sure.
We don't know, none of us know we don't know what we don't know. And the more training that we can give our staff to identify needs, the more we can work to meet them.
Fantastic. Yeah.
I think the Department of Workforce Services Y-Train EMS grant, how that improved access for more EMS providers. I think if that could be continued, that would help on the EMS side of the house. But I know that, if that could extend into nursing or other things like that, I agree. I think the high schools is really an untapped resource for a lot of things. We try to take the mentorship students and things like that, but I think getting the youth involved early would be good. So I agree, access, I live in Moorcroft.
Yeah.
OB, pediatric care, those are all things we either have to go out of state to get, or we go to Gillette to get, but, and then trauma care.
Yeah.
At a state that doesn't have a level 1 trauma center is crazy.
This place is full of love. You can tell the people that like to be with old people because they really take care of you good and are very kind.
Twice a day, every day, the activities people have an organized activity that's always interesting.
Everybody loves to play bingo. We play it 3 times a week here. We also have ceramics that you can paint. Really pleasant to live here. It's a good place to be.
Completely understand. From a patient focus, how do we feel about access? Is there enough access in Weston County? Do you feel like it's appropriate for living out in the community?
We've just brought on a new nurse practitioner who will be doing women's health as well as pediatric care. She'll be at our Upton clinic as well as our Newcastle clinic. She'll be working 5 days a week. She'll begin October 6th. So that was also brought up in our community assessment needs, that we felt like that was an area that we could expand upon. And luckily we've been able to attract her to come to this area, and that's going to be something that is also enticing, is to be able to keep and retain those people. We've had locums in our facilities for a while. Community doesn't really understand the locum provider, they're only on a certain amount of a contract. And so it's not that we're not trying to keep them, it's just we have to be able to afford to be able to retain them. And not a lot of people want to move to our small town. So we have to find the right fit for our community at the same time, and I do believe that our new provider is going to do just that.
From a patient point of view, one of the things that I have heard and seen, partly because of what I do, attending these meetings, attending other functions and stuff like that, is the EMS really needs to be beefed up. Personally, I've never run into the problem that I've heard about. Every time I've needed it, they were there quickly, they got me into the hospital quickly. 2 times I needed to be transported, one to Gillette, one to Rapid City, and that process went smoothly, as out of it as I was, especially going to the Rapid City one, but to me it seemed like that went well. I do know that the clinic has had a lot of problems of different kinds, and I personally pulled away from the clinic and has gone somewhere else for just primary care. But now I've heard things. My wife goes to that clinic and she is happy with the improvements that she has seen. I've been hearing about them in the board meetings, and so I think that is well on its way. I'm really excited to hear about some of these specialists, like OBGYN, diabetes, that one concerns me. Other specialists that they are trying to recruit into this place, and that I think is very important, but we've got to make it attractive to bring people into, especially when you realize how remote Newcastle is from other areas.
Right. Thank you.
I read just lately that it's in Teton County, there's somebody training midwives. And midwives have always been a problem in Wyoming. It wasn't even legal until just the legislature or so ago, but now it's difficult. But somebody is training them. If we had midwives available here, either train them here or get them from Teton County or wherever it's coming, I think that would improve things a lot, because if people have to go out of town to do their OBGYN, then they go out of town with the baby then for pediatric care. The more they go out of town, the more they buy things in other towns. And they have less trust in our hospital and community. If we had, I think this, maybe I'm wrong, but it doesn't seem like it should be very complicated to get midwife providers here, whatever you call them. And with our Amish community, we sure have a lot of babies born here, but they're not born here. Well, they're born in somebody's kitchen. But they would use midwives if they were available. And you would go to Gillette for midwives. Well, what's the point of a midwife if you travel 80 miles? And they don't show up with birth anyway because it's too far. It seems like that would be, if it can be happening in Teton County, maybe that's something that could happen here.
Can I speak on that? I do with the MCH program here. We do have midwives. They come, yes, you can get some from Spearfish, Rapid. Yeah, there's different, I have moms that actually use midwives from around. It's a specialized group in a couple of the different areas that you can hire actually to come to your home.
Here.
You can hire them to come here to your home, but they have to be a specialized group, probably because of the liability of being a nurse midwife. It's not like the old days where, I think the Amish do their own thing there, and they all kind of help each other out, like the older people, the grandmas and stuff. But if you want to have a baby in your home here, you have to hire one of the companies to come in.
But you would have to plan ahead.
Well, most of the time you have several months to plan ahead. They come and they watch, they follow you. They follow you just like your doctor would. They come to your home and they come see you, the baby a couple of times after the baby's born as well.
Do they get here in time though?
Most of the time they do.
Do they?
I know you were trying to raise your hand earlier, so I wanted to come back to you.
I have forgotten what I was going to say. I do have some stuff I want to say.
Sure.
But anyway.
No, that's fantastic.
I don't know.
No, that's fine. Before we move on from this first one, because I know we only have an hour, so I want to make sure we get through everything. Yeah.
I
Go
do
ahead.
have one,
Yeah,
if
please.
you don't mind. I'm a county commissioner.
Yep.
And we've run into an incredible problem, one, budgeting for medical care for our jail system. And so what we run into is, I have a headache, and we take them to the emergency room, and $2,200 later, because they've run through a series and it might have taken an aspirin. So we're trying to discover what we can do with telehealth and also on the mental health side, to go through that process, because what it's doing is incredible. We try to budget one thing and it doesn't quadruple. It may be 10 times, it may be 20 times as much, which takes away from the other services that the county provides. So that's a big struggle for us as a county.
When you don't have behavioral health, that's also something that would be very beneficial in our area. One, to be able to have it as our inpatients and our acute care is starting to transition, and then the social benefit of the outside providers as well.
Yeah, no, thank you very much. Okay, so before we move on to the next one, what I would like to do is just from your personal standpoint, now we all wear several hats, right? But from your personal standpoint, let's just do a show of hands. Is the number one priority in your community lowering the cost of care? Just raise your hands who is. Okay, after that, how about access? Is that the number one priority? Okay. 2, can you keep hands up? I just want to take the numbers. 21. 22. Sorry, you know what? I went to law school, not math school. I apologize. So,
I haven't raised my hand. Took me a minute.
Okay, so then quality of healthcare delivery. Where is that? Anybody? No? Yes? 1. All right. Fantastic. 1. Did I miss anybody?
Does that mean we don't think we have good quality, or
No.
does that mean we want to maintain what we've got?
I would say on this, what we're just asking is what is your highest priority? These are all priorities. We can all agree to that for sure, but what is the highest priority out of those 3? So, any changes? Okay. All right, so from the second exercise we're going to move on to, this one's a little bit more complicated, but just bear with me here. So here we're going to ask you to rank the following types of healthcare priorities. So picture yourself and kind of try and get into this role that you were moving to here, Newcastle, Weston County, or just anywhere in this region, please. What would be your top must-haves? So we just talked earlier about high schools trying to retain folks. I'm born and raised in Wyoming. Tell you, I want to see more of my folks. I wish there was more of my high school classmates that stayed here. But you know, what are some of the things that, if you had to rank them, would keep you, or that you find to be the most highest priority if you're moving to a community? What do you expect if you're moving to a community? So what I would like you to do is just please fill in all of these and rank them 1 to 12. So you'll see emergency room, hospital inpatient, ambulance service, primary care provider, having a pharmacy in your community, and this would be a brick and mortar setting, right? We love telehealth. I do a lot of telehealth myself with my daughter, but we're asking from a brick and mortar standpoint, what do you believe is the highest priority in your community? Labor and delivery, we've already talked about that already, which is fantastic. Specialty physicians, how about long-term care and home health, nursing home care, mental health, hit that as well. PT, just any type of therapy in that standpoint, dental, and then also vision. Vision's important. My dad was an ophthalmologist, so special place in my heart for that. Okay. So just a little bit of time, go ahead and go through. Again, remember, highest priority is going to be 1, right? Don't give it to 12. And then lowest priority would be, well, just I would say, hey, all of these things are priorities, obviously, but it's just what is, I would say, you consider it as a nice to have versus highest must need, I do expect is your number 1 in your community. So, as I'm filling that out, does anybody want to start us off with, out of this list, what you see as the highest priority in a community that you're moving to?
Primary care.
Go ahead.
I remember what I was, so it was kind of just I was talking to a neighbor, an older gentleman neighbor the other day, and And he was talking about just how much, and I totally agree with him, he wants to keep emergency room, the ambulance, doctors here in town. And that's, you know, I have the emergency room and the primary care providers down as my 1 and 2. Because it's important. It's important to our town. And just on a little bit different note, kind of as the, I think that it's really important that we use this money, since with it being a one-time event, that we use it on things that isn't perpetuating money that we don't have. You know, that we use it on things like the training piece. That's a wonderful thing that can reap benefits all throughout our communities if we use it on training, and because it lasts. And the other thing that, and I don't know, there's people that know a lot more about this than I do, but and I'm not sure it fits with my last statement, but if we could use it on the ambulance and the EMS stuff so that we aren't having to tax, do the districts and tax our people. And I don't quite know how that works, but, you know.
Go ahead.
I have a question about the $500 million.
Sure.
What are the strings that are attached to it?
Sure.
Is it require Medicaid expansion? What does it require?
Right. So the funding itself is an application, right? It is federal funding that has been appropriated. If Wyoming does not apply for this, or for some reason we don't get awarded it, it will be redistributed to another state. Like, this funding has already been allocated. It's out the door from the federal point of view. The strings attached to it, well, there's certain areas that it can be used in, right? There's about 8 categories that are very, very broad.
It's going to take a lot more than a 5-person economic development board, or the 7-person city council, or the 5-person county commissioners, or even the hospital board. The public at this point really needs to have a stake in the game and needs to come forward and to have some honest discussions and some ideas, and even more than just the community, I'd say the younger people, those younger people in their 20s that are in Newcastle and Weston County raising their kids, those people that don't want to leave, those people that want their kids to grow up in Newcastle and graduate an NHS Dogie just like they did. Those are the people that are going to have to step up and come forward and offer some solutions and do a little bit of soul searching and becoming a more active member in the community.
That says that you must use this in this setting. A little more detail will come out in mid-September with the notice of funding opportunity that comes from the federal government. But as of right now, it's going to be mostly just reporting of what are the outcomes, what are the services that you used, how did you use the money, and then making sure that you used it in the allowable sense, that we didn't go and put it, in something that's wholly unrelated to what it was supposed to be sent to. So that's the extent that we know of right now, and that I'm aware of. As for Medicaid expansion and stuff like that, no, that's not a part of this. And this is just a one-time investment. I think the Trump administration saw this as a significant opportunity to use this as an investment in rural communities where we know there is challenges in the healthcare space.
No, and that I was asking because of Anne's point. It's a very good one. Like, if we establish a whole OBGYN wing with that money and it funds it to open it, then afterwards we still have to staff it and keep it going, and we've created a long-term expense. So we have to be very careful about how we spend it in that sense.
Right.
So.
Sir.
All I was basically gonna talk about what Carrie just said was, if we have this money and we start funding positions and creating new wings or whatever, that continue, that after 5 years, they're still gonna be continue to have to be funded. And so the taxes, they'll come back on the taxpayer. And I know everybody loves free money, but no money is free. It's not. especially from the federal government.
I appreciate that, and, you know, to your point, I'm with the government, and I'm here to help you.
Just briefly, a couple years ago, I sat in the county commissioners meeting when the Regional 8 Department of Health and Human Services came on and said, we've got a bunch of money, we just want to give you money, and we don't care how you use it. And that's what they were doing. And a lot of people took that money, well, not a lot, but I know our county health was applying for a $102,000 grant. And after that call, they got $110,000. That they weren't even, well, $100,000 more than they were originally looking for. And so we're talking one county here, right? There's 3,100 counties in the country that are gonna be wanting all this money.
Sure.
And there's no money.
Right, and I should clarify
Yeah, I'm
the
just saying,
funding
there's no money
opportunity
when
is
you can't be $33 trillion in debt and offer people money. And we're all guilty when we take this money of enslaving our children. That's all. Thank you.
No, these are legitimate concerns. I appreciate you bringing this up. These are all considerations we
And I love
have to have. Yeah, no, but we have to have that, and we have to have those conversations, so I really appreciate that. And that's something that we really need to focus on when we are applying for this funding, is that, you know, those concerns are extremely valid, so let's use it for a very good purpose.
And the other thing I heard, because you said, well, if you don't take it, it'll be allocated to another state. And I hear it in commissioner meetings all the time. Well, geez, if we don't take it, somebody else will, so let's take it. Even though we're not looking for it, let's take it.
Sure.
Or somebody else will. And we have fear of somebody else getting our money, you know? We get all tight. Wow, geez. So, anyway, thank you.
Yeah, of course.
I'm Thomas Voss, and I'm a city councilman, and you can tell by my wrinkles that my first two choices here was emergency room and an ambulance. But what I see is that we're really talking about here is a system. To have an emergency room, you need a hospital system, and you need it well-funded. And I would like to see some help to where we set up a system in our county and our cities that we are funded here. To sit around and wait like baby birds and open our mouth for money to come from somewhere else is not a real good financial plan.
Right. Yes.
And I think that we need a real good financial plan, and that's where we need the help. And I know that the boards and the city council, the county commissioners, we're all short of money. And that's where we need the help, is developing the system. From I don't care if it's from ground up. I don't think it needs to be from ground up, but we need a better system. And the whole rural America needs a better system.
Yeah,
Keep those emergency rooms and ambulances.
Can I make one small suggestion for like this meeting and future meetings? I feel like there should be a little bit of a differential between 911 services offered by EMS and interfacility transfers. And there is a pretty significant difference there when it comes to access to care and the availability of providers to do what it needs to do. I mean, I know Governor Gordon is a huge fan of volunteers, and volunteers make the work go around, but when you put two people into an interfacility transfer, that takes them out of service up to 13 hours. When we send the Denver transfer out, I mean, that's time away from their full-time jobs. That's time away for businesses that are employing those people that can't have them be gone for that long. So then it falls on larger services. There's limited availability of ambulances. We have 18 ambulances in our fleet. We don't have enough staff in Northeast Wyoming to facilitate every individual need that's out there. And that's why we're utilizing it as a system, like Mr. Voss said, you know, utilizing flight, utilizing helicopters, utilizing ground ambulance services. But it is, I think, a significant difference between a 911 response ambulance, where you might be out of service for an hour to get a patient back to a hospital for stabilization and care, and an interfacility transfer.
Yeah.
You see that as different companies, working with different companies, or?
It's just a different kind of business model, really. So that's where I'm seeing it.
Thank you.
Yeah.
Kind of tying on to what he was saying there. think Marty could actually speak to this a little bit more, but like when you have transportation to Rapid or to Gillette, I got transported to Gillette once by air. That was $78,000, and that falls under Title, what is that?
No, the other one, what you're talking about is Title 25.
Title 25, but it is, those type of things are kind of, they come in, oh, then that's for like, help me out with this.
Involuntary.
Involuntary, and these things become unfunded mandates. The county has to pay into this, but the county is not given money to pay into this. And that comes from the state, and that's a problem. The whole Title 25 thing I see as a big problem, and that's something that I think should be resolved a little bit more. I mean, somebody uses this, they get transported from the jail to a facility, whatever it is, and you get these Title 25 issues coming up, but there's no money for it in the county, and the state requires that the county pays for it. That's a problem.
But I don't think the Title 25 has to worry about the ambulance or air stuff, right?
We have to get them to a facility.
Okay, so some we do have to use air.
Right.
I understand it's not like regular patients, but it's a different situation, but, yeah.
I'd like to see a Title 25 compliant holding facility in the county, so that the counties, and I asked for that to be taken up when the vote was to fund the expansion of the hospital. But no one would talk about it, but we need that in this county, so we're not bankrupted every time someone's Title 25.
What does that mean?
And that could be a one.
Title 25
You
is
can't
about
just hold
voluntary
people anyways, you can't pick
Yeah.
a Title 25 person on the street, put him in the jail, and have a nurse watch him. There are requirements for care.
Generally, mental health patients, suicidal patients, patients who need psychiatric help, and we don't have here. And they need to be sent, to somewhere else, and the county gets the bill on that.
Don't we have a locked room, a room that's, I don't know.
That's my office, Barbara.
Did they let you out?
Okay. Anybody else about priorities? Yes, go ahead.
I was just going to say, in terms of priorities and to your point with the EMS discussion, we have to set realistic expectations. And a realistic expectation for ambulance is hard to do in a community as big as ours. So if I live at Walter's house, I should expect an ambulance in 10 minutes. If I live at Ann's house, I can't expect an ambulance in 10 minutes. So to say that we have to pay for an ambulance system that serves the entire county in the same way, it can't be done. It's impossible. So money isn't the issue then. You can throw as much money as you want at it, at a problem like that, and you just can't do it. So we have to set realistic expectations. Your thought of separating, when you talk about ambulance, separating emergency EMS from interfacility transfers is, I think, a really great step in setting a priority. Because if Anne can make it to the hospital, then she should be expected some kind of help to get her to Rapid City if it's an emergency. But, there's a chance that, we may not be able to get all the way out to Ann's house to pick her up. So it's expectations. We have to set realistic priorities and expectations.
So just to pause there real quick. So when we put this together, we put ambulance all together, mostly because the same service across Wyoming does both interfacility and 911. But I did want to pause just to make sure everybody's on the same page. Do we understand the difference there between 911 versus interfacility? Mm-hmm. Okay, just wanted to make sure. All right, anybody else have any discussion on this piece before we just kind of go through and see voting?
Well, when you're asking priorities, the emergency room is the number one, because it's always started there with me. Then the other things fall in place underneath that.
All right, Okay, so we'll do the same thing that we did on exercise one, or the one that we did just previously. You're gonna go down and just show me a list of hands, please, that'd be fantastic. But starting with emergency room, who sees that as top priority? Okay, 1, 2, 3, 4, 5, 6, 7, 8. 17. All right, how about hospital inpatient services? Okay. All right, ambulance. 1, 2, 3.
Of course.
4. All right, and then how about primary care providers? 2, 3. Okay. Labor and delivery. Okay. Specialty physicians.
Miss Pharmacy.
Oh, sorry, Miss Pharmacy. Thank you. Pharmacy. Okay. Long-term care, nursing home, home health. Okay. Mental health. There we go, one. Physical therapy. And then we
I
go
vote no.
dental and vision. Okay.
I'm voting every chance I get.
Okay.
This is not a democracy.
So now we're getting to really open-ended discussions. I'm going to ask Lindsay to help us out, which is writing things down as they come out. But just
The new store. This is the one-stop shop. We have a pharmacy. We have a bootlegger's liquor. The deli, the food that you can get at a lunchtime is so amazing. The coffee shop. Certain Friday mornings, there's 30 people sitting here in all these chairs. This is the hub for people to come and visit, have their coffee, have their donuts. It's amazing what this area has done. Totally amazing.
will you take a few minutes and look through the first prompt? Here you have, will you write down a list of things that are going well here in Newcastle or just Weston County in general? And you know, what we're focusing on are either existing healthcare services that you are currently utilizing or things that you know about in the community that are going well right now. So just take a few minutes, write some things down, and then we'll go over that.
I have two right off the bat.
Okay.
And it's just personal experience. I've always thought that our emergency room really is well done. And I've got a couple people in this room right now that have seen me while I've been in the emergency room. You're always treated with the utmost care, really good care. And when you need to get transferred, they knew it very quickly. And sometimes that took a little bit of time to get going, but it's always gotten going in what I would consider a reasonable time. And one time, my life was saved because of it, because of a heart attack. Another is, I think our pharmacy works very well.
I put down our doctors, but it has a history to it too. The lady sitting behind me's father took care of me when I was young. And Dr. Franz, and we had Dr. Franz, Dr. Thorpe, and Dr. Stevenson. Then we got Lanny Reimer and his crew, and Dr. Jordan. And we have just been always blessed with good doctors. And I
Yes.
hope that stays up. I'd like to know a system that we could keep that going.
If we have that, it facilitates everything else.
That's
Everything
exactly
else,
right.
absolutely.
If we have a primary care physician looking out for us, then we get to the right specialist, or we get to some hospital we need to go to, but we need a primary care person who knows our names.
Exactly.
Who was that said that?
That's good. That's okay.
We gotta take Lanny out of retirement then, that's just it.
Yes.
It's agreed upon, Dr. Reimer.
I have to argue with my sister.
I know.
What else is going well? We have physicians, we have pharmacy, we also have the emergency rooms going well. Go ahead.
We have excellent services in our hospital, meaning we have great high-quality radiology services. We have great
Very
lab
nice.
services that will allow most patients to stay here and get their services done here without having to go far away for testing.
I think the physical therapy is really well done there too.
Yes.
And we're expanding even more, we're getting more specialists to come in and do outpatient
clinics,
That's gonna be so
ENTs
cool.
and whatnot.
That's good.
I think our communication in our facilities as well as with public health, and EMS, just the openness, and that comes from our top down, from our CEO, and what her vision is that what she wants to have for our communities. Keeping our clinics open at the same time, making sure that all of our county has access to care and listening to that. But we also have to have our community come into our facilities.
Right.
We can't just say, well, that happened 5 years ago. You've got to realize that that was 5 years ago. Got some great providers.
Yeah.
Dr. Reimer decided to leave, but he has a great following, and it's hard to fill those footsteps.
Mm-hmm.
But I think that the providers that we have in our clinics now are doing as good a care or even better.
Fantastic. Yes, sir.
As a veteran, I want to just put out the community care that we get with the VA that is really a benefit to us, either driving to Hot Springs, Rapid City, or Sturgis, rather than being able to go to our local community hospital. So that is a real blessing. And what is the Wellness Wednesdays or something that you all do as well that I mean, I don't use it, but I hear it often on the radio. What is that?
So you can come in to the Upton Clinic every other Wednesday, and the Newcastle Clinic opens at 6, and you can have all your blood draws, your INRs, things like that if you have any questions. But we also have walk-in clinics, so even though you're a veteran, if you want a doctor here, it's very easy for you to do that by requesting a authorization and selecting a PCP here, and then we can get that services installed for you. All it takes is an authorization for VA for you to see one of our physicians, and then they will list all of your diagnostics and your morbidities, and then we would be able to take you on. So you wouldn't have to travel.
And Wellness Wednesday, can't you get all your lab services and stuff for $10?
Yeah,
Which is
It's a
amazing.
health fair
It's a
at
health fair.
very, very reduced cost, but you pay up front. And we have a sheet, it's limited testing, you can't get anything done, but it's pretty common tests you can get done for a very, very, very reasonable price.
It's all in the market. And like I said, that goes in both of our communities that we do that, so that people don't have to travel just to Newcastle. We're doing it in our Upton clinics as well.
Thanks.
All right.
From what I have heard, what's going well is that the clinic has improved a lot in the last year. And I've heard good things about it.
Fantastic.
It's improving, and from what I hear from the board and some of the hirings that they are doing and allowing the CEO to go out and hire, the way that they're doing it, they're finding the right people, I believe.
Fantastic.
So I think the future's good for them.
Good.
We also have some non-hospital services available, like the senior center has vans that can take people. They have lifts for wheelchairs and all that. As far as transfers or out of town appointments or whatever.
The VA has a representative for that too.
What?
The VA has a representative for that too.
Cool.
Do they bring their van or something?
Yep, you just contact the guy and he
Oh,
will take
that's
the
right.
veterans
He's
to
a
their
private
appointments.
individual, yeah.
So, just in the interest of time, because I know some folks are going to need to leave us at noon, we're going to move on to the next one. But before we do, just a quick show of hands. Just in terms of things going well, we've heard things, I heard positive things about telehealth, so I just would like to know, generally speaking, do you prefer to be seen in person in a brick and mortar setting, or would you prefer, or not really, it doesn't make any difference if you're in a telehealth setting? Just if you prefer brick and mortar, please raise your hand. Okay, so that's 1, 2, 3, 4, 5, 6. Okay, so the vast majority of us would prefer to be seen in person. Okay, now if you had to be seen in a telehealth setting, do you find that to be, not as sufficient, or, any thoughts on that just quickly, because I do, we need to move on.
I don't really know.
Okay.
I never tried.
We've never tried it, so I'm not sure which one.
Because we have such an elderly aging community
Sure.
here, I think the technology bases would need to be explained or have a younger generation,
Yeah.
a high school age child that can teach their mom and dad.
Fifth grader.
Exactly. And just have the availability. I think that that's gonna be the most important part. A lot of people don't like the email.
Sure.
They like to be able to have that personal touch with the physician.
Yeah, that makes a lot of sense. Yeah, go ahead.
From a mental health perspective, we do have 2 providers who are able to see patients in our community now, but it's not full-time. And so most of our mental health providers are telehealth, and that can be a real challenge, whether it be for the patient or the provider. I mean, there are things that you can't see over that TV when it comes to a mental health setting. And I think from a mental health perspective, that is huge in our community. We have people who can't afford or don't have a vehicle to go out of town to see a provider. And then what happens is when they can't be seen, or there isn't a place for them to be seen, they have Title 25, or they end up in jail because then they know they can get seen if they end up in jail. And so then it becomes a law enforcement issue, which that's a whole nother conversation, keeping them staffed. And so it's this cycle. And so while I think it's really important that we talk about physical health, we're missing a huge piece when we're not acknowledging the elephant in the room that mental health is not being addressed in our communities.
That new thing out by the fairgrounds, that new building with.
That's the VOA, which used to be Northern Wyoming Mental Health Center, but the last I knew, they do not have an in-person therapist. It is all telehealth. The only 2 therapists that I'm aware of are Casey Bergstrom and Leslie Heyman. They have another one?
Yeah, Nikki Cutter.
Okay.
So now we have 3.
And she just comes to the facility and then watched on video. Is that what's happening?
That's the way, I haven't been there lately, but.
Nikki
That's-
Cutter's like, she lives here.
So we have an FBO.
And she is busy right now.
Yeah, because so there's three,
Yeah.
and I know like Casey goes to Gillette too, so she services that community.
Thank you very much. That's a really important point. I do want to get to you, sir, before we move to the next question.
Just quickly, my only experience with telehealth was during the pandemic, when doctors would not prescribe ivermectin or hydroxychloroquine. They were letting people suffer because they didn't believe in it. And so I was forced to go outside the medical profession. I went to the wellness company or Chase Medical, and I could get what I needed and talk to doctors there that believed in ivermectin and hydroxychloroquine. It saved a lot of lives as a result. So sometimes we're forced to go outside mainstream medical because they won't adhere to what we believe in. And what saved a lot of lives during the pandemic.
That's why I couldn't get Wormer for my horses, thank you.
These were prescription, this wasn't.
I was taking the horse stuff myself.
All right, so really quickly before we move to the next one.
As long as it's apple flavored. it's all
A
right.
real quick thing, I wanted to say that one of the things that's going well in our community is the Manor.
Yes.
That's another piece. But anyway, that was just a quick note.
Thank you.
That took a
do you
while.
want- The Manor, do you want to just explain for folks? Okay, so we're gonna move into our next question, and I recognize this one comes with, a little bit of a can of worms. So what I would ask, as we move into this one says, what are things that are not going well in the community? We have a lot of folks in the industry, and we just are a large community. I mean, Wyoming in general, small town, long roads. So let's just be respectful in our comments here, please, that's all I would ask. But we want to know what things aren't going well in the healthcare space in the community. Trust. Go ahead. Trust, I heard.
I was just thinking in practical terms is I think these interfacility transfers are a problem. And I like your point of it's different, the EMS versus but it's just something that it would be nice to figure out how to fix.
And just so I can press really quickly on that, we say interfacility transfers aren't going well. So recognizing vast majority of that's happening because a higher standard of care is needed. So what exactly is not happening?
So the time, like we've had at least two instances here recently where we had really sick people and we could not get an ambulance to transfer them from our hospital to a bigger facility. And then the things that aren't so, like just in general for my family, it makes it hard to want to stop here at the emergency room when we know we'll have to end up going to Rapid or Casper.
Yes.
So it's just like that piece and that piece of getting people from here, which is where it's good that we need to be able to have the stability here of having stabilized patients here and then move them to somewhere else where they need to get their more, critical care.
Yeah, no, that's a great point. Highly, I think that's a high priority. One of the things I just wanted to also express with this is that it sounds like that's an access issue. And would you categorize it that way?
Yes.
Okay, and some of that also, I know, obviously, sometimes it's availability of EMS, sometimes it's availability of just rooms in a different facility that they're trying to transfer to. So I'm just gonna, think that's fair, it's an access issue? Fantastic.
So sometimes the access, if we're calling it an access issue, we're farther away from people here. I mean, from other facilities here, and we have a lot of weather.
Sure.
So sometimes it's not a problem that money can fix. Yes, having more ambulances available, and more crews to be able to send, sometimes that's the answer. But sometimes we're just not able to transfer people because we can't get a helicopter in the air and we can't get an ambulance on the road.
In addition to the weekly printed version of the newsletter journal, we also promote our community and share important information on our award-winning website, newslj.com, and in our weekly email newsletter, Nuke Now. We also connect with readers through various social media platforms and invite you to check us out on Facebook, Twitter, and Instagram. You can even take a look at a recent meeting of the City Council, School Board, or County Commission on our YouTube channel. We do hope that you will go to newslj.com and subscribe today, and we look forward to making all of our great content available to you. But regardless of your level of support, we thank you from the bottom of our hearts for doing your part to preserve a free and independent local press.
The weather is an issue and you can't fix that with money, so.
Yeah, but
I want to stick up for my EMS friends over here.
Sure.
You can have more ambulances here, but if you're not using them, they're just sitting here.
Right.
So I think that's the problem. They have a crew here. I mean, they come out of Gillette. So when we do need a transfer, they have to wait for someone to come. So is it cost effective to just have somebody sitting here? So I think that's a real fine line of what do we do?
And that was part of my point too.
Yeah.
Sometimes
No,
it's not their fault.
No,
it's not.
absolutely.
I think the only other thing is the navigation of the healthcare system in general. Pre-authorizations, making sure that the benefits and opportunities for extended services are really hard for the community to understand how the process works, to make sure that we don't have to balance bill them or that we don't get a pre-authorization in time. That's just frustrating, and I think that goes back to our training, is to make sure that we have someone that can be an advocate, someone that can explain to them, and communication of this is what our process is going to be. I think a lot of times when people say, well, I can get it faster in Monument, well, that's great. They have 15 people that are working strictly on pre-authorizations, and if we really want to keep Mountain Care, we also have to understand that it does take a little bit more time.
Sure, no, totally understood. All right, we're gonna go to our EMS folks and we'll go right back to you, so.
This might not be under the auspices of this particular grant. I think one of the challenges for healthcare organizations has got to be part of the reimbursement for what it is that we're trying to do. If you're talking sustainability, I mean, that's where the sustainability model comes in from, right? We're a not-for-profit agency, and it's really hard for us to even break even a lot of times from operations, not to mention the cost of healthcare, the cost of salaries, everything continues to go up. I mean, the price of an ambulance, 2019, for us, it's $268,000. Today, it's $335. And that's one small cog in the healthcare wheel. I mean, how much is your new CT machine? We just spent $4.3 million on a linear accelerator in Campbell County Health. I mean, that cost comes up, but the reimbursements aren't tracking with the same level of increase. So, I mean, even revoking the 35-mile rule would make a difference for EMS and transporting, because there are EMS agencies that are in communities, but they're not performing the same kind of services that the other services are. Not charging for services, but since they exist, that 35-mile rule kicks them out on, increased reimbursements.
Sure. So what he's speaking of is actually a federal payer rule when it comes to how much reimbursement comes back. So these are federal rules of reimbursement from.
If you have another facility that can transport, so like if you're living in Sundance, for example, the terrain, you can ask for an exception to have that be reimbursed to the hospital, but it's very hard to get that exception. It's also really important, I think, that we have to understand that we live in a community, very rural. And EMS doesn't matter, doesn't matter, but it means that if we had a cooperative, that if they were in Sundance and we didn't have somebody here, maybe it's a triangle that maybe we pull another ambulance unit to come to here while they're going there. Something that has to work, because I know, for an example, for myself, you're gonna have to have a four-wheel drive, or you're gonna have to have a county plow in if it's snowing, or you have extreme weather. But that is a choice that we make where we live, and you also have to make sure that you have preparations. I mean, if we get something that we don't get a lot of service, I can't call 911 unless I run back to the house. Well, that's also something that we have to take into consideration, but there again, as a taxpayer, I'm willing to pay more for those services so that I can have those services. They're important to me.
Yeah.
But it's very hard with our aging community as well, because they've been paying into Medicare, their retirement, and our inflation is going up. They're not getting any more reimbursement on their savings. And so it's really hard for them to maintain their lifestyle.
Sure. Thank you very much, sir.
It was just covered.
Covered, okay. What else is maybe a challenge, something that isn't necessarily going well?
I think that having these specialty doctors, like we have one fellow that I have become friends with, and he did my hip, and next is my shoulder, but it's Dr. McElhaney, and he comes here from Rapid City. And I don't know how to get more of those people to do just that, like he's doing, but I don't know, maybe we could, kidnap their children or something.
I know our
But
CEO is working on
we have to
that.
have something to inspire them to come to.
Our
Yes.
CEO is working on
Yes.
bringing in more outpatient services.
I love to hear that.
EMT, and we have endocrinologists that are coming down.
Last few hospital meetings, you ought to attend them. The last few hospital board meetings have been, in my opinion, some very good information coming out, and what the CEO is gonna be able to do here in the near future in bringing in specialists and things like that, for like diabetes or cardiology. That's gonna be
So much
wonderful.
of the community is not aware that we're getting more things.
So
So ask around, they got their
Get
heads
that
in the
out to
sand.
Barbara.
I do my job.
Well,
That's all
we
I
have
can
a
do.
newspaper, we have Facebook.
Yeah.
I mean, how else can we get that information out to the community?
Newspaper and Facebook.
It has to be like coffee groups or something, I don't know. People don't even know that you can get a mammogram here, and we've had the new machine for years. People don't, they may read the paper, but they don't internalize it, and they go to somewhere
On
else.
October 22nd, Showcase Night, and you'll be able to see amazing things happening at the hospital.
Couple more things. I know we're almost at 1 o'clock, so I want to get quickly to a few more folks. You had your hand raised. Did you want to say anything there?
My point was when we look at the cost of things, or we look at money going places, money always goes more to hospitals and buying ambulances and stuff because they're physical and they're large costs. But if you want to get more doctors here, you have to look at doctor reimbursement as well. If no doctor is going to come here and spend the whole entire day here and see 3 patients who pay him $30 each. You just can't. It's not. So you have to look at the reimbursement rates for doctors too, and it is a smaller piece of the pie, but it's very important to access.
Thank you.
It really is.
No, thank you. So this is going to be, I'll get to you real quick. Okay, so this is kind of a personal question. I have a daughter that has special medical needs, and frankly, we live in well, we live in, might as well be New York City, Cheyenne. And we have to because of, access to care. That's just what it is. So just especially for your children or from younger folks in the room, is there anything that maybe is preventing you from staying, or is there things that you see, are graduating classes, they're leaving? Is it in the healthcare space at all, or is that just not an issue whatsoever? And just leave it at that.
I stay because I like the community and I want my kids raised in the community, but like you, I have a very high medically needy child. We drive to Denver all the time.
Sure.
It is what it is. So when she needed surgery, there is no pediatric surgeon in this area. Our choices were Sioux Falls or Denver. Sioux Falls, we were 100% out of pocket because they wouldn't take our insurance, so we had to go to Denver. So I mean, I'm just used to it, I guess. But it would be nice not to have to drive for that stuff, but.
It doesn't make too much of a choice on where you're going. Okay, fantastic. All right, closing comments, maybe folks we haven't heard from yet. I know there's a few folks that maybe haven't spoke up. Anything that you see at Prairie? Yes, sir.
I just have a question.
Yeah.
Just looked at online at a consultant firm that's going to help people write these requests.
Sure.
A lot of things, a lot of it is telehealth, AI, providing payments to healthcare providers for provision of healthcare items and services as specified by the administrator. So if that's really in there, you all need to get that out to these people so they know, put it in there, if there are some payments providers. Because this whole thing isn't that. And that's a lot of what you need to keep financially everything going well, system, if you will.
And just a quick point to clarify on this, what we're doing is we're trying to hear what are the priorities and then basing anything off of that. Ultimately, it's going to be the governor's recommendation, but.
And I'm understanding it, but I'm challenging you to help these.
Sure.
This is the first time this has happened. It's only going to go 5 years. There's one application.
Right.
If there are tricks that we all don't know here, you need to tell us, so we don't get revenue out of this rather than just systems that we'll have to pay for later. Another one they said was recruiting and retaining workforce with commitments to serve communities for at least 5 years. So if there's some salary assistance, that needs to be communicated, available.
Yeah.
That needs to be communicated to these local boards so they know to put it in their application.
So what?
And then the question extending that is, does that apply to doctors or providers they have here now?
Yeah.
Does it have to be a new one? Could they get that benefit for the current providers, keep them at least that 5 years?
So to speak to those, you're going to see a lot of information from a lot of different states. You're going to see a lot of information that is out there online. Strictly speaking, there is not the specifics out there from CMS on what exactly their guidance is. These are broad categories that are going to be, as the states see, fit to be used as long as it's allowable according to whatever application goes in. What I'm trying to make with that is there's going to be broad categories. Yes, we have to meet at least 3 of those according to what we've been told so far. However, we don't have the specifics, and we will absolutely get the information out as soon as we get the information as well. So.
Well, and somebody mentioned trust, Marty or somebody, as a problem, and it is. And part of that is because we don't have our doctors we've counted on for years, like Lenny, and that. It's always, people are coming and going at the clinic and the hospital because we have the traveling doctors, except for Dr. Franklin. And people don't trust, and a lot of people go to the hometown medical clinic here on Main Street because there is less, or one of the reasons they go there is less turnover. And so there's more chance to build trust. And if you know somebody, and some primary care doctor is taking care of you and managing all those problems like specialists and all that stuff. You have one, you know about the opportunities available here at our hospital and home health and all that. You find out about it through I think that's one of our problems is longevity. If we have what Lenny just said about the 5-year retention thing, that would be a big, and I guess we do that through money. I don't know, it buys everything, doesn't it?
Closing comments.
I have a question for you, Miss. What does it take to be on the transfer team? If you're transfer a patient from here to Rapid, is that EMT level, paramedic level? Is that something a nurse could do?
Yeah, it depends on the level of care needed in the back of the ambulance. The state of Wyoming scope of service says that anybody from the EMT level up to RN can attend a patient in the back. On occasion, we will also request an RT go with us, depending on the level of the patient.
Okay. So is this something that
Respiratory therapy.
this money can be used to maybe help hospitals get their own, just transport, EMT or paramedic or whatever, and then that person can be utilized within the facility working with the nurses and helping on the floor and help them get all the supplies needed for, the ambulance itself and all the gear needed?
Yes,
To maybe take
broadly
that
speaking-
burden off of?
Yeah, broadly speaking, these likely fit into those categories. And, what I would say though is, we want to hear ideas, we want to hear what these can be.
Right.
And, there's a lot of opportunities with this, so.
So maybe that's something for
It
Weston
is.
County we can focus on. So it's when you guys so soon, but maybe we utilize those people, so they're not just sitting there.
And what I would say is, as artists, like we have talked about, is that kind of funding. So as we build infrastructure, as we make investments, we got to make sure that there's not a cliff on the end where we've built up something that is no longer, sustainable. So,
Right.
Great ideas today. Thank you very much for coming and speaking with us and taking your lunch hour with us. We'll hang around for a while if there's anything that maybe folks want to come up and talk to us individually about. But I would just say thank you very much. This has been extremely
Next time, bring sandwiches.
Just a quick aside,
Yeah.
when you all said that you're looking for times outside of the workday,
Sure.
noon on a Friday is not outside of most of our workdays. Just throwing it out there.
I appreciate that.
Thank you.
And please hand us your worksheets.